usually.
Okay, we might just start the meeting. Just to let everybody know, I don't think we've got a live feed at the minute. They're going to try and get connected as the meeting goes on, so stay quite hang up if that's okay. So welcome everyone to today's meeting of the social care panel. Through the convener's open statement first. So welcome to this meeting of Liverpool Council Social Workers Social Care Street panel. This meeting hopefully is being held remotely and also personal with recorded live with subsequent broadcast available through the Council's website. The Council is a data controller under the General Data Protection Regulations and the Data Protection Act 2018. We broadcast before 20 meetings to fulfil a public task obligation to enable members of the public to observe the democratic process. Data collected during the process will be retained in accordance with the Council published policies available through the Council website. Members of the Council are reminded that they should follow the Council's established meeting protocols, including around the use of the chat facility. And the comments made from the chat facility are visible to all participants in the meeting, which will include members of the public who have also received invite to the meeting. So, item 1, the remaining apologies, substitutions and declarations of interest.
We have apologies from Councillor Reynolds, Councillor Law, substituting. Which is a lot of points in there. We have apologies from Councillor Reynolds, Councillor Coffey, substituting, and Councillor Brooks. We now move to a roll call. We're asking for declarations of interest. The board members, please indicate if there is either in person or remotely. Councillor Armstrong.
Present in the chamber.
Councillor Cassidy.
Present in the chamber.
Councillor Clougherty.
Present in the chamber.
Councillor Beasley.
Present remotely.
Councillor Jackson.
In the chamber.
Councillor Law. Councillor McCluskey.
Present in the chamber.
Councillor Mackenzie.
In the chamber.
Councillor Quinn.
Present in the chamber.
Councillor Robertson.
Present in the chamber.
Are there any declarations of interest?
Councillor Foster.
Thank you, Convener. I have a correction to item 6 on the agenda by reason of a close family relative residing in one of the care homes mentioned in the report. I've applied the objective test, do not consider I'm an interest in declaring this an update report for noting the care home in question is not the subject of any specific commentary or officer recommendations.
Councillor Cassidy.
Thank you, Convener. I have a correction to item 6 on the agenda by reason of our relative board of organisations mentioned in the report. I've applied the objective test and I do not consider that I'm interested to declare because this is an update report for noting and organisations that are subject to any specific commentary or officer recommendation.
Councillor Law, still isn't online. If we don't know what the councillor was, it okay, just continue to move the items if it's promoted within the objection. James, do you have a question you want to ask?
Thank you, Convener. I've just spoke to Councillor Law and she's having some technical difficulties and she will be on in a couple of minutes, she said.
Okay, thanks, James. We'll hang on a few minutes.
She's just having a problem connecting, she said if you proceed, she'll be sure that.
Okay, we'll go to agenda item 2, the review and capital budget report, Marie Cares. Is that yourself, Steve?
Thanks, Katrina. Yes, I have to present the budget monitoring report for social care services to the 31st of August, being period 5. This shows a current projected underspend of 1.228 million to the year end. This is mainly in relation to the external care at home service and vacancies throughout the services. Capital budget for the year is 1.346 million, with a current projected slippage of 784,000. Updates on each of the projects is included in the report. I'm happy to take any questions. Thank you.
Thanks, Marie. Is there any questions? Martin?
Thanks, Vera. I just want to go to page 13, just on winter planning and winter pressures. Just that we come into this period with obviously a lot of attention being placed on how well prepared services are for the winter, and I noticed that 712,000 earmarked for winter planning and care at home. I was just looking for some assurance, and this might be something that perhaps maybe for Alan Stevenson, is just some assurance around our planning for winter and whether we are adequately resourced for what might be quite a challenging winter period. On a related point, I was just also wondering how the recruitment exercise for further care at home, given the understanding that's in this paper, how the recruitment exercise that we have started through TV ads and media advertising, how that's been going, whether that's borne any fruit yet. And just very finally, I understand, I've got a copy of it here, a letter was sent to local authority leaders earlier this month, among other things, from the Cabinet Secretary for Health, suggesting that local authorities should be looking to recruit volunteers to support care at home. But from my point of view, that's quite concerning that the government are looking to ask local authorities to recruit volunteers rather than, investing in the services many of us have been calling for a very long time. I was just wondering if you've got any reflections on that. Thank you.
Rena, through yourself, thank you for those questions. I'll take the last one first, if that's okay. It's not unusual for us to receive a letter from the Scottish Government just before we kick off in winter, so it's no different from any other year where the Scottish Government come back and ask the health boards, the councils and HSCPs for their kind of state of readiness in relation to the winter. People will be familiar with my update each year. I'll tell you that we're one of the best partnerships in Scotland around making sure we get folk home and we reduce the number of delays at IRH. So that's on record with performance. So this year is no different in relation to that, in relation to the Scottish Government asking us what is our state of preparedness. When you look through the letter from the Minister, and we're quite fortunate today, Alan's here, who's the main person that runs our response at winter time, so maybe Alan can get an opportunity to speak as well at some point. So we, as we do every year, we start preparing for the winter in springtime. So by the time we get to the summer, we've decided the things that we're going to do each year. We review what we did the previous year. So we are absolutely prepared as best we can be. The letter did mention the use of volunteers, and we've got a good history of using volunteers in Inverclyde through the winter period, whether that be voluntary transport, whether that's the work that we do with the Carers Centre, who put staff out into IRH so they can speak to carers as family members are due to go home. So the whole range of activity around that. We also work with Compassionate Inverclyde, who do No One Goes Home Alone. So when there are when we have come across older adults who have no family at all, this year we're looking at using a small amount of volunteers to assist us to make sure when people go home that package is successful. I have to be honest with you, we very clearly of the view that what will get us through the winter is primarily our care at home service within the council mainly. We've been working very hard, and we do every year, to make sure our care at home service, that's the backbone, that's where our success lies in relation to getting people home. So there is an absolute place for volunteers. The volunteers themselves are a small part of the jigsaw in relation to what we need to put in place to successfully make sure folk that are discharged from hospital don't end up readmitted again. So there's lots of preparation that starts in the spring. That letter is not wildly different from the ones we get every year from the Scottish Government, looking for assurance and to give the committee assurance that we do all that planning early on, basically just after the winter, which we regard winter as from October through to May now, because winter doesn't finish in February or March. We're still dealing with the consequences of winter into April and May time. So I think that answers most of the question. I'll maybe ask Alan if he's got anything else he wants to add, convener.
Thank you, convener. Just to confirm, we actually went through almost a year-round process past few years. We've had in August, for example, we discharged 155 patients to a care, either to a care home or back to their own home for support. As usually the figure we operate in the height of January. So we are quite anxious for what's going to happen this year, but we have put measures into place, as Alan's discussed. We've brought in extra assessment staff. We've used money to bring in extra allied health professionals to help with the prevention of admission as well as facilitate discharge. We've also purchased some interim beds within a care home in the guide to allow people to go somewhere to wait until a package of care is available for all their first care home choices available. So these are unusual steps for us. We don't normally take that step with the beds, but this year the challenges noted that.
I'll do an update on the recruitment campaign if something's going on.
Convener, yes, through yourself. So one of the other things we were very clear this year is we really wanted to focus our efforts on the recruitment in care at home. I think members have heard me saying it's the backbone of the service. So we have, if you like, we went further this year, further than ever before. We started off with a recruitment campaign through radio. We then refreshed all our social media tweets out. You'll see the new kind of try to grab people's attention around some of the social media activity. And this year, for the first time, we used winter monies to actually put a television campaign together. And I hope members have seen some of the adverts on STV and Sky. So I personally think they're excellent. They show Limerick quite well. There's 3 personal stories for people in our workforce. It's real members of staff, it's not actors. So basically that's ongoing in an attempt to really do everything we can to encourage people to come into social care. We have 24 staff recently in the last 2 to 3 weeks that have been interviewed and been successful in terms of securing a job. And I think since the TV adverts have been on, our care at home staff saying that interaction with members of the public has been robust. So it's generating interest that we hoped, and it's just showing people, whether it's a younger person still at university or college, whether it's someone who's changing their career, having been in retail for a number of years, or someone who's come up through the ranks in terms of Alana. It's just real stories about real people that are coming into the service. So Alan and I and others, we're very optimistic that it will raise the profile of care at home as a career. So it's just slightly early, but I checked in with the team this morning and they said that the levels of inquiries have increased. So I'm hopeful that we can convert those into staff that come apply. We've got another rapid access available tomorrow in terms of recruitment, which we've been doing, that I've told members we're out in places like Tesco's in Port Glasgow and helping people to fill an application form. So we are doing absolutely everything we can to, because we'll get through winter by having as many care at home staff available as possible. So I will be able to update the committee moving through the winter in relation to how many additional staff that we've attracted as a result of the current campaign.
No more questions, sorry.
So, thanks, convener. Well, first of all, I've seen the adverts, and I think the adverts are absolutely fantastic. I think they're brilliant. I have a question about Appendix 3. Is it material variances? I expected the children and families line in there, and I don't know if it's somewhere else, if it's under assessment and care management. I didn't know where it was.
Alan. Oh, sorry, so.
Hi, that Appendix 3 is actually an exceptions report where it highlights if there's an exceptional variance in the service. So if you look at further up in the report at table, I'm just going up to I'm doing it the new fangled way on the computer today. Up at table 4.1, you'll see that children and families is projecting an underspend of only 28,000 at the minute. That's why it's not highlighted separately.
Thanks very much.
Any more questions? Vote report. Agenda item number 3, an update on the National Care Service. Alan?
Convener, through yourself, thank you. I had the absolute privilege of attending the Health and Sports Committee a couple of weeks ago, and I hope members won't be too harsh when they see my input to that. It was a very interesting session in relation to the National Care Service. It's part of the scrutiny in relation to the National Care Service, and there was 4 chief officers from across Scotland gave evidence at that day. So I tried to give a flavour of where we are in Clyde in terms of the submission that we put forward in relation to welcoming some of the excellent ideas about ethical commissioning and hand stripes for carers being 2 of those issues, but also I think I tried to put across to the committee that there are obviously concerns about the way in which this is kind of moving forward. And there's a real anxiety about the amount of time we might spend on structural aspects of this, when actually what we should be looking at is how we're going to improve outcomes for the people who require our services. So that was part of the kind of scrutiny that's going on at the moment. They expect that stage 1 scrutiny convener to run through to the 17th of March 23. That was supposed to end in September, so they've extended that stage 1 of the scrutiny, and that will also involve additional sessions around further scrutiny, and they're kicking off in late October time. There's also other pieces of work across the Scottish Government, and I think members might be interested to know in total there are 60 subgroups across the Scottish Government that are looking at the National Care Service. We're all feeding into the main National Care Service team within Scottish Government. So it gives you, these are 60 distinct work streams that have been identified through we run through the process. So there's a lot of activity going on. There's also work will be going on around issues in relation to children's services and criminal justice. So it might not appear there's too much publicity, but there's certainly a huge amount of activity going on now in relation to the National Care Service as this work will starts to come together from the various parts of the work that needs to be undertaken, and not least start work around, one of the unanswered questions is in relation to children's services and justice. So just to give the members an idea that the scrutiny session, there's actually a transcript for that, and that's available, and we can share that with members if people are interested in it. So there's a broad sense that in terms of the Chief Social Work Officers, we don't have any information to suggest there's going to be any change of direction in this. So I made it clear as the Chief Social Work Officer for Inverclyde, my preference would be for us to be integrally involved in this. There's no point in sitting on the sidelines. We have made a position quite clear in relation to some of our concerns around the National Care Service, but certainly I welcome the assurance that Chief Social Work Officers and other senior leaders across social work in Scotland will be involved in this work moving forward. So lots of activity underway, lots more activity to come, and there'll be further opportunities for us to put forward our views as this piece of work develops. Thanks, Nadia.
Thanks, Nadia. Thanks, Alan, for that update. I watched some of the session. It was good not just to see yourself being very robust, but everyone else who was presenting, especially after such a robust response from the council. I just wanted to ask a couple of questions about the implications for workforce at the moment. That's something I'm quite interested in. Just looking through the responses to the Parliament's committee, all the unions basically that represent the workforce in social care all expressed the same sort of concerns. So, just to pick a few here, GMB said social care staff can be asked to take a leap of faith without knowing what they're agreeing to. Unite the Union, there are no proposals in the bill to address the serious concerns of the workforce who work hard through the pandemic, caring for the vulnerable with little rewards. Unison, the bill creates additional stress and insecurity for a workforce already overstretched and struggling to cope with demands resulting from the public health emergency. So it's clear that the staff unions feel that there's clearly not a lot of information being shared with them, and this is all quite vague. I'm just wondering here in Inverclyde, but how is staff morale with this change at the moment? How are we communicating with our workforce? And thinking back to the last item on the agenda and the pressures on workforce at the moment, is there anything additional that we can be doing to communicate this change to people and to make sure that people feel reassured about their jobs into the future?
Convener, through yourself, I think there is uncertainty across the workforce. We try our best now. We're speaking to, within the senior management team, we're speaking to the service managers and making sure people are aware of reference points in relation to where we are. I think, to be fair, for the majority of the workforce, it still feels like something isn't either ready to happen or going to happen. I think there's a feeling that it's quite a far way away. We will, in due course, be obviously setting up information sessions with our own staff when we get a better understanding of just some more of the detail, because there's a lot of information we're still trying to understand and make sense of. So I think in terms of what's in people's head, people are probably more interested at this moment in time in negotiating the winter and getting through that, because they know with COVID and the flu, because they know what's happened in Australia, we're expecting a very challenging winter. So I would say at the moment, people still see it as quite far in the distance and not too sure about what it means for them. One of the things that has come up is a number of the staff have said, raised concerns about that they seem to be still making a differentiation between the council workforce and the health workforce, because there is the suggestion that staff could be moved across to the new National Care Service from the council, but health colleagues, within the information I have just now, we're led to believe there'll be no transfer of NHS staff. So I think people are probably a bit unsure about if you're changing to something new. Effectively, that's what we already have. We have two sets of workforces. So I think people are a bit puzzled about some of these core issues about, is this a real thing, or is it going to be just a different version of what we have at the moment? But I think in terms of concerns, most of the staff that I've spoken to are more concerned about the current pressures around winter. But I think we will undoubtedly we will need to put a programme together as we get to understand more of the consequences if someone's decisions are made, because we can't really tell the children, family, staff, for criminal justice at the moment what's actually going to happen, because we know we're going to probably likely start with adult services, but there is a further consultation to be had around children's services and justice. So it's quite difficult. In our experience, you're better going with staff and giving them hard factual information rather than going and saying, listen, we're not too sure about this, it might be this and it might be that. That doesn't particularly help people, it doesn't give them the clarity. So I think once the winter's over and they start to see some more information coming back out about the National Care Service, that's when the staff, the kind of level of interest and inquiry will absolutely increase. We know it will increase, but it just seems a bit further away at the moment.
Thanks.
Thank you, thanks, Convener. I mean, you just said that there's like 60 plus work streams in the Scottish Government in terms of progress, and that's what it really does. That shows the complexity of the issue. It's not a one track issue that we're dealing with here. There's lots and lots of different aspects to it that need to be considered with their own degree of depth and breadth. So it's probably in a way heartening to see that there are over 60 work streams, although I'm not a fan of industries or beasts that need to be fed, so it needs to kind of be a limited thing, and obviously it will be. The questions that I've got are about our level of linked-inness to that 60 plus work stream beast. To what degree and across how much of the works, or how many of the work streams are we linked in, so that we are influencing our voices of lived experience and working experience and all these sorts of things are fed in right across the decision making in terms of this and the preparation in terms of this. A second question would be about our unions, or not necessarily the unions. I'm taking on board what Priestland McCluskey said about the union feedback on this. It is really important that the voice of the workforce is not only acknowledged but acted on in terms of how this pans out. It's something that we've said that we're going to do across a number of parties in the Parliament, but it needs to happen properly. So our workforce are a really key point in that. So what do we know what the kind of union involvement is in those 60 plus work streams? And my third question is a kind of I'm asking you to make a wee judgment call, you know, if we're seeing it as extended scrutiny, it was, things were supposed to have ended in this phase in September and it's moved on to March, did you say? Is that a good thing or a bad thing?
Convener, through yourself, thank you. So this 60 plus, some of those 60 plus are around internally within the Scottish Government to make sure these departments are speaking to each other. So I don't have a breakdown of 60, I just know it's 60. So there's a number of those that are inter-government, so that most of the departments are all thinking about and understanding what all this means for each of their services. So there's a few different levels to this, because you have people, your organisations like COSLA, Social Work Scotland, professional bodies who will be invited on to the appropriate work stream issues. In terms of us, if we bring it right down to Inverclyde Council, the two main injections at the moment, if you like, are through the Chief Officers Group. So Kate Knox will be involved in work around that, and the Chief Social Work Officer, the role that I've currently got, there's a Chief Social Work Officer group that plays into. We have been told as each of these groups develop, we will be looking for more and more people to come on and come off the group. So we will get to the point where we'll be asked for representation from heads of service managers, team leaders and staff on the ground. So that will be a natural build-up as they get the momentum starts to fill. So I think we will be as much at the table as any other organisation in our position would be. So just to give you that assurance that both Kate and myself initially are the senior officers that are linked into that work. Trade unions are also will be invited. Absolutely understand it's a partnership approach, it's co-production, whatever word you choose to use. So the trade unions they've submitted their own evidence in relation to the sports committee, and at some point they'll obviously get that opportunity to play into that as well. And as I say, it's part of the work that we'll do, bring it back down to an Inverclyde level. Whenever the HSCP do everything, they work with the staff partnership group, so we'll do it jointly. So it won't be a solely management piece of work we'll do. We'll take all that information to the staff partnership group, where we have trade union reps from the council and from the NHS, and we will work out whether it's focus groups, discussions, whatever it's going to be, it will be done in partnership with the trade union. So there'll be representation at an Inverclyde level flowing back up the way. Is it a good thing or a bad thing? Finally, I think there's been a lot of activity, so I think it's sensible that that timescale has been extended to make sure that that evidence gathering is robust as it can be. I think, to be honest, part of that we're probably also caught unawares a bit because we went beyond feeling, and I think people were expecting the feeling and were ready for feeling. But when the Scottish Government extended it beyond feeling, I think there's now more of an opportunity for other parts of the system to start to play into that work. So I'm not surprised it's been extended, and I think it will ensure that scrutiny happens before we get to the next stage. And I'm sure Kate herself will be asked to be back at the committee giving the evidence at a future date as well.
Questions answered? No one else? No questions? No. No report. Move on. Item 4 is the Inverclyde alcohol and drug update. Gail O'Brien will be giving us update. Gail.
Hi, convener, can you hear me okay?
Yeah, loudly. Yeah, nice.
Okay, thank you. My name is Gail Cobain. I'm the Service Manager for Inverclyde Alcohol Drug Recovery Service and Homeless Service. Today I'm representing the wider ADP to give an update on the ADP report. This is just to provide the scrutiny panel with an overview of national and local updates. Panel members are asked to note the contents of the report, note that it's been presented and approved at IGIB, and it's going forward to the Alliance Board for partnership approval. So this report covers a number of key national and local updates. The National Change in Lives report from the Drug Death Task Force makes recommendations across 4 key headers. Context, and that's probably around drug deaths and the National Task Force work. Culture, which places an emphasis on ending stigma, discrimination and punishment, replacing these with care, compassion and human rights. a care approach, what's needed to deliver an effective, consistent, person-centred approach. It builds on that principle of people with drug dependency should receive parity with anyone with any other health conditions, and coordination which sets out the foundation for change, including targeted resource and decisive leadership. We're working towards some of these actions across our ADP partners. Some of that narrative is incorporated into the report below, and some it's within the ADP annual return to the Scottish Government, which is attached within Appendix 1. I'll just focus on a couple of key areas. 3.6, which is the medication assisted treatment standards, that reinforces that rights-based approach to treatment, ensuring that people have immediate access to treatment they need with a range of options. And the Scottish Government MIST team have developed a reporting framework based on data, processes and experiential learning. Excuse me. There were a couple of reports published around the MAT standards, which indicated that Inverclyde was red for MAT 1 and 2 and amber for MAT 3, 4 and 5. Although we do offer same-day prescribing, some factors impacted on the data, such as non-attendance at first appointments. And I think we've had quite a lot of dialogue with the MIST team within Inverclyde. And just this afternoon, just before I've come on the call, I've got an email in from them thanking us for the work that we've done. They've actually been to Inverclyde and they're now confident that MAT 1, 2, 4 and 5 are being met, and we've got good evidence of that. So nobody else actually knows this apart from this committee. We're still doing work on the pathways to ensure that those currently not known to service have a clear route into treatment at same day. In relation to 3.14 around drug-related deaths, the statistics around gender, age and deprivation are areas that are well documented. The reduction of 33 deaths in each of the previous 2 years to 16 last year is clearly a step in the right direction, but obviously we can't be complacent around that, given that there's obviously significant factors around things like street diazepam. And I think part of our role is to work hard to get people into treatment and support them to stay in treatment where it's appropriate to do so. 3.22 highlights issues around alcohol-related deaths, and we had 26 recorded alcohol-specific deaths. Again, that's a reduction from the previous year, which is again to be welcome, but we're yet to understand the longer-term impact from the pandemic. Inverclyde Alcohol and Drug Recovery Service is led on the board-wide pathway work, and at this point we're undertaking an impact assessment to determine what we need to increase our capacity, because we're already seeing demand increasing locally. At 3.28, we're part of a board-wide initiative with Glasgow City. We're about to embark on Mental Health and Substance Misuse Pathfinder programme. This was commenced in Tayside in 2021. And it's looking at the connectedness of mental health and addiction support. Beyond that, and this is just in the very early stages, so we're just in the discussion stage with HIS about how Health Improvement Scotland, about how we launch that programme in Inverclyde. And at 3.35, that outlines the funding which is coming to Inverclyde via the ADP. The ADP will be developing a spending plan which will support increased capacity in the statutory sector and also across recovery organisations and the wider community. 3.4 outlines the highlights of the annual report. That's attached in Appendix 1. It's question-based and designed to reflect national policy and rights respect recovery, the alcohol framework and national mission priority. This is obviously a very brief overview of the ADP work to the scrutiny panel, and I would ask you to note that, and I'm happy to take any questions.
Do we have any questions for Gail? No. Gail, can I just ask you one thing, and it's on 3.2, the Health Improvement Scotland proposal. It says the project staff who are based in Glasgow but Inverclyde with dedicated time. What does that mean? What's kind of support we're talking about here?
There's a project team that will be assigned from HIS, and they will be based in Glasgow. As I say, it's early stages yet, and probably we're in the discussion stage as to how we launch this. I suppose they're based in Glasgow, but they'll be given parity of support across Inverclyde and Glasgow. It's just that how they've been recruited, it's just where they'll sit, but they will host it and we will get equal access to that support. So we've got slightly different objectives, but we'll move forward together. And we have a bigger board-wide ADRS and ADP work that we do quite a lot jointly with, so we'll make sure that we're on the path. But they've actually recruited the post in Glasgow, but we'll get equal support.
Gail, are you finished? You just seem a bit quiet.
Yeah, I'm finished, thanks.
Oh, okay, thanks, Gail. No, any questions? No? Okay, we'll open the floor. We'll move on to item number 5, Inverclyde Adult Support Prevention Partnership Biennial Report 2020-2022. Alan, it's yourself.
Thank you, convener. This is a biannual report which we have the duty to provide every 2 years to the Scottish Government. It's drafted on behalf of the convener of the Adult Support Protection Committee, who signs this off, and I've presented the report on his behalf, if you like. So it is for noting. Obviously, the past 2 years, focus of the work of the Adult Protection Committee and the partnership has been around responding to the COVID pandemic. I know it was seen to be far away, but it was actually at the time new measures of supporting people, carrying out our statutory duties safely and safe for service users as well as our staff, and that we have been still protecting people. We also had focused on partnership work, which is the statutory partners we work with, as well as the third sector and staff partnership as well. We've actually worked quite hard with our staff group to get some work going around safe practice and also how we can look at future developments. We had, as the panel know, we had an inspection during this period of time, so a successful inspection, and we've been working on that previously. With the implementation plan came after that inspection, and we're working on actually finish that plan off the change that we're asked to put in place. The other major piece of work is obviously SCR, which is currently underway, and it's been supported the reviewer carrying out that SCR longer planning. So going forward, there will be a business plan that will be developed following this report. The focus will again be around the SCR, be around finishing up the implementation of the improvement plan for the inspection, and also looking at greater partnership working and working with service users and people who have experience about sport protection and form and practice going forward.
Thanks, Alan. Good questions. Elizabeth?
Very quick question really, and thanks, convener. Just checking the timescale and where we are with this report. Has it been approved by the committee already and we're just getting a look at it? Or is it yet to be approved by the committee?
Convener, through yourself, this report will go back to the Adult Sport Protection Committee. It's an opportunity for the scrutiny panel to give us any feedback, and if there's anything we can agree on that needs to be added to the report, we will do that, and we will then be submitting a final version.
Thanks, Alan. Any more questions?
I've got nothing to add to it, by the way. I'm more opportunity. I was just kind of checking if we had the chance to. That was all.
So will this report come back to Alan? Just a moment.
Convener, through yourself, if there was anything materially different, I would suggest we can bring it back, but obviously I can speak to you once we get the report finalised if there's any material change.
Thanks, Alan. Okay, we'll move on to any private session now.